Welcome everyone to the Medical Biophysics podcast series. Today we have Dr. Stanley Liu, a clinician scientist at Sunnybrook, right? You're at Sunnybrook?
That's right.
Nice. So we're just going to be asking him a few questions today on his research and his job and his career. So first off, just want to know a bit about your background and the path you took to become a clinician scientist. Did you do an MD PhD program, or how did you get to where you are today?
Great question. And thanks again to you and G for inviting me. So it's very nice. So I guess just going back very quickly, I've always been interested in biology. And so I actually pursued biochemistry at Queen's University. And I had great fortune. This professor, Lita Raptis, she had sympathy for me. She allowed me to work in her lab for the summer, even though I didn't know a lot at the time. And I got very interested in the oncology research. And I had some oncology courses my last year. I got very interested in a lot of my colleagues in biochem were saying, oh, you should check out MBP in Toronto. It's a great program and stuff. So I went down there, somehow got into the program, and ended up starting my PhD with Jane McGlade in signal transduction. So that was a great experience. And our lab actually ended up moving to Sick Kids at the Brain Tumor Research Center, headed by Jim Rutka, and there were other clinician scientists like Mike Taylor, Peter Dirks. And so during the latter part of my PhD when we're there, I got to meet them and got inspired about the great work they're doing and kind of life as a clinician scientist. So I decided I would apply for medical studies in Toronto, and miraculously somehow managed to get in and did studies at U of T there. And then along that vein, I'd done some clinical electives in oncology and decided I was actually most interested in radiation oncology, and then applied for radiation oncology residency and did that in Toronto, and then did a short fellowship abroad in Oxford, and then came back, and that's where I am today. So bit of a long haul, but well worth it.
So follow-up question. How long did each of those take you?
It's funny because, when you mentioned that, I remember when I was searching my grad studies, and my parents were like, you should just get a job, forget it, you're going to be in school forever. But anyways, I said, no, I think, this is going to be fun, I'm going to do it. But it's actually scary if you add the amount of time from undergrad. I don't know, it's got to be over 20 years. It's got to be
cumulatively,
yeah. So the key is I've enjoyed it during the way. There's been a lot of bumps, and but overall you enjoy the journey, and I think that's what it's about. But yeah, it's not a short process you're doing. It's essentially lifelong learning, right? But so a while there, but lots of great experiences and learning along the way.
So why did you end up picking prostate cancer as your main focus, or do you also focus on other types of cancers too?
So in our specialty of radiation oncology, we generally will treat one or two sites. They're quite specialized now because the complexity. What I find most interesting about prostate cancer is, as you probably know, it is the most common cancer aside from skin cancers in men. So about 1 in 7 men will be diagnosed with prostate cancer. And just to dispel some of the myths, we do see a fair number of younger men as well with prostate cancer. So it isn't just an exclusive cancer of the aged. So that's important to know. So, it's a huge, significant clinical problem. And let me start from an oncology standpoint. So from radiation or surgery, there's a lot of good, effective local or regional treatments that we can do. So from a radiation standpoint, which is my expertise, you can do brachy, you do high dose radiation, you do external beam. There's newer focused SBRT 5 treatments that we could do. So there's more and more advances coming all the time for very precise, effective, and well-tolerated treatments. Then you can look at it from the systemic therapies. So how do you target cancer throughout the body if it's spread? And I mean, there is just every year a new large number of clinically approved, very active hormonal treatments, as well as even radionuclide treatments that are being used to help improve survival and outcomes for these men. Even if we can't cure them in that setting of metastatic disease, they have very good effective treatments. So from an oncology standpoint, it's a great specialty. It's a great, I should say, cancer to work on, because there's a lot of treatment options, and you get to manage patients from early stages of the spectrum to advanced stages. Now, taking it to the research, what makes it actually very interesting is there's still a lot of the biology that has to be worked out. Despite how many decades people have been working on it, there are so many important questions. So one of the questions we're interested in is, the biology of recurrent cancer when it comes back after treatment. But there's a lot of research that's being done to come up with so-called biomarkers to predict how patients are going to respond to treatment, or to predict, does a patient actually have aggressive cancer up front? Is the biopsy actually telling us the gold truth of what's going on? So there are basically, great clinical tools, clinical issues, and a lot of research that has to be done. So for a site, I guess, as a clinician scientist, it's great, right? It's a great synergistic blend of the clinic and the research, and that's why I'm still doing it today.
That's awesome. That's good stuff. So then, stemming from that, I guess, what are some of the more specific or current areas of research and projects that you're working on in your lab with your students?
I guess the overall arching goal of our research is to try to improve outcomes for men with advanced prostate cancer. So when I use the term advanced, what do I mean? I'm talking about men with high risk prostate cancer that's localized but has still a high chance of coming back, men who have metastatic disease, so cancer that's spread at presentation, or also men that have cancer that's come back in the prostate after, for example, radiation. Okay, so we're trying to look at different ways of improving outcomes for those men. So one of the ways we're doing it, so one of my PhD students, Jessica, her project is basically trying to address the very important question of predicting how a patient with advanced prostate cancer is going to respond to these very systemic therapies, because there's a whole ton of them, and they all have different side effects. They all are believed to work well, but there's no biomarkers to predict how well a patient is going to respond. So what she's doing is she's actually trying to, for each of these patients, we're getting a biopsy of the prostate up front, and she's trying to grow cells and actually test them with a whole panel of these are drugs that patients, the government covers. It's just, we don't know which would be the best treatment for. So she's testing them with a functional assay, and then we're going to correlate that with clinical outcomes. And what we're hoping is that, if we identify, say, a patient's cells that are intrinsically less sensitive or somewhat resistant to these treatments, then through collaborations with other scientists to try to do genomics and proteomics to then really dig into the biology to figure out why that's the case. So that's kind of the first area we're doing, was once again trying to grow a patient's cells and test them with treatments. And the second one is near and dear to my heart, as a radiation doctor, is, although it is very effective treatment for prostate cancer, we know sometimes it comes back. And if it comes back in the prostate, that's a problem, because when you're giving more radiation, it can often cause excess toxicity, which we don't want to do. And, figuring out the biology of why that happens in the first case. Why do we have one patient's cancer that came back after radiation and the other didn't? And then in line with that, how do we come up with new approaches to address that problem? Because it is still a significant problem. So this is an area where another grad student in my lab, Wong, he's basically trying to look at combining immunotherapy or checkpoint inhibitors with reirradiation, using a lower dose of radiation to try to get the immune system to attack the cancer. So that's one approach. And then we're also looking at changes in the in immune cells during radiation. Can those help predict how well a patient's responding to prostate cancer? So those are just kind of some of the broad strokes of what we're doing in the lab. Well, it keeps us busy every day. Well, keeps my students busy.
So does your lab have, is it more wet lab, dry lab, or a combination of both? And do you do any computational stuff as well? What does your lab consist of mainly?
So that's a very good question. It is primarily a wet lab. The techs and students in our lab spend at least the vast majority of their time at the bench, and tissue culture, and a lot of time in the mouse facility.
Yeah.
Really get to have a lot of one-on-one with their mice. So yeah, a lot of that is wet. We also run a biobank, so we're collecting patient samples from the clinic to use for ongoing and future biomarker research. But to be honest, and this is something where I think for research, it's sometimes hard to be a jack of all trades, right? Especially given how specialized it is. It's no different than in cancer, where an oncologist treats one site. So with research, we actually have collaborations with various other labs here at Medical Biophysics. So people like Thomas Kissinger, who does proteomics, Hanson Key's lab, who also does a lot of great biomarker research, Han Liang here at Sunnybrook, Bob Kerbel's lab here, who's helped with some of the in vivo stuff we're doing. People abroad, we also have Paul Boutros and many others that that have just been instrumental. So those are people helping us with some of the more specialized stuff we're doing. So we tend to, in terms of the computational stuff, to have those resources and expertise, we tend to do those through collaborations with our other colleagues, scientific colleagues.
Nice. Yeah, I think that's definitely a big benefit to this program, is having the ability to collaborate with so many different specialized laboratories and researchers. So yeah,
Exactly.
that's really good. Yeah. All right. So you recently published a study on immune cell profiling in prostate cancer patients treated with different forms of radiotherapy. So how does brachytherapy change the immune landscape compared to external cone beam radiotherapy alone? And what does this mean for patient outcomes?
Right. So that research was based upon the clinical observation that brachytherapy, so what brachytherapy again is where the clinician will place high dose radiation sources into the prostate. And the prostate gland tends to be one of these entities where the higher the dose of radiation you give, generally speaking, the better the chance you're going to control the disease. Okay, so it's not seen in all types of cancers treated with radiation, but for prostate, that's generally the case. So the view has always been that when you give high dose radiation with brachy, which is much higher than what you can give through external radiation, that we know you get better control in keeping a man's PSA, which is a blood test we use to monitor the disease activity. It has a better chance. High dose radiation, brachytherapy has a better chance of keeping that PSA low, meaning cancer not coming back. But there was an interesting retrospective study that showed that actually it may also translate to a reduction very early on in the development of metastatic disease. Okay, so that it might be having some systemic effect as well, not just within the prostate. And so what Eric's project was, and in collaboration with our great clinical colleagues here at Sunnybrook, we were able to collect bloods from these men with high-risk prostate cancer receiving both forms of radiation treatment, so the high dose and the brachy and the external, just to see what was going on in the immune system, right? To see if there were, in fact, differences. So it was a pilot study, but what was very interesting is he found in this pilot study that the men who received the high-dose brachytherapy, that there were different changes happening in the T cells. Okay, specifically in a subset of the T cells called the killer T cells, or CD8 T cells. They seem to be getting more activated by the brachytherapy treatment compared to men who just got the external beam treatment. So we think that there is a distinct, immune process going on, and I mean, that's something that I'm sure, another excellent MBP, Shane Harding's lab, is working on as well, and I think he's done a lot of great work looking specifically at how radiation can activate the immune response. So, but looking at brachytherapy, it seems like there is a distinct difference. So does that mean that that's actually, educating the immune system so that it can help attack, micro metastatic disease? That remains to be determined. But yeah, that was a very interesting study and a nice combination of some translational research with clinical samples. So.
And also, you guys work with, or you work to establish a lot of primary cell lines. So why is that so important, and what is the benefit to that to clinical research?
Right. So that's a very good question. This is actually very interesting in that, prostate cancer, as I mentioned, it's the most common cancer of men. Mm-hmm. Okay. But it has the least number of cancer cell lines to do research with.
Oh, okay.
So like, for example, like breast and colon, also very common cancer, or lung, right? Mm-hmm. There's probably, tens and tens, if not hundreds, of cell lines already established. In prostate, the most commonly used one, there's probably like 4 or 5. Okay. So they are notoriously difficult to establish. And the problem is the current cell lines that we have, the current models we have, they only reflect a very advanced cancer, usually the type of cancer that has stopped responding to something called hormone therapy. So unfortunately, a lot of the research that's been done on these models may not necessarily be translatable to localized prostate cancer that hasn't spread, or that's in an earlier stage when it's still hormone sensitive. The other issue is that it doesn't also represent the racial diversity of men. They're primarily Caucasian samples, so there's a lot of, and a lot of these cell lines have been passaged for decades. So how truly representative there are. So there's a lot of limitations. So really, with Jessica's project, she's using an approach that seems to be working in terms of cultivating these cell lines for multiple passages, and retains their responsiveness to hormone therapy. And so one, she's going to be able to generate a lot of representative cell lines. The second is that she is also, by generating cell lines, she's able to test them with the whole gamut of therapies. And so this is addressing the important clinical question, which is, how do you pick what the best treatment is for man? If you go to a clinician currently, they're going to use very empiric metrics. So they're going to say, oh, either you got high burden disease, low burden disease, or, I think you're going to be most likely to tolerate this treatment. And that's how the treatment is chosen. It's not chosen based on a patient's biology. So if we can actually grow these cells, test them in very quickly within a few weeks, correlate that to how well a patient actually does in the clinic, and show that that can actually be predictive assay, that I think will be, very important for helping better personalize a man's treatment. And at the same time, generating these new models where we can actually study the, clinical heterogeneity of cancer, but also have a more racially diverse collection of cells too.
Yeah, greater representation would be definitely more influential for this research, right? So that's really good. All right, so for the prospective students looking at applying to MBP, what kind of qualities do you look for, or actually make a student stand out the best and make them most successful?
That's always a really tough question, to say what are the ideal things, because every student's different. Everyone brings their unique perspective to the lab, and that's what makes it great. So I don't like to have any preconceived expectations, but to look at it from what are the ideal, if you will, although debatable, is to first say, listen, if you're going to be able to really stick it out in research, you got to have that natural curiosity, that I love biology, or I love, computational biology. I want to understand what's going on. So I think that a natural curiosity and interest in research is very important. I think if somebody has had practical lab experience, so that they've kind of gone that extra mile to do some research during the summer, or do a thesis project, that also just shows maybe that they're a little bit more committed to the process, and they're truly interested in that aspect of research. And then, the very many, and I believe this is equally important, is the personal qualities that a student brings. So, being a team player and being collaborative, because science these days is so collaborative. It's not just one lab or one person doing everything, right? It's a whole part of being, a team. And let's face it, when you're in the lab, you're probably with your colleagues in the lab more than you are with your family at home, right? So they are your family in a sense. So being able to work well, interpersonal skills are absolutely essential. And, being motivated and determined, not being able to give up, because, well, Aidan, you were telling me, you're doing a PhD, right? You must have come across some roadblocks and stuff. You've got to, just stick with it and keep getting up and,
Even at the beginning of my project, it's, you got to persevere for sure.
See, that is the one thing. I think perseverance exactly is key. So, it's not just one thing. It's a mix of things. And, some of these qualities you're just going to, you're constantly developing during your grad studies. You're going to pick up some of these things too. But not an easy question, and everyone's different, right? It's hard to say you must fit this mold. Yeah, but I think what we discussed, some of the key things that I think might help with success in a PhD.
Nice. So what type of style of mentorship do you try to embody with your students, or promote, at least? Like how do you interact with your students and go about your communication with them and project design?
Yeah, I like to be involved. I hope my students don't think I overmanage, so I'm a control freak, but no, I like to be involved in the lab. I'm lucky at Sunnybrook. So although my office is in the Cancer Center, it's literally the Research Institute is just through the tunnel. So it's like a couple-minute walk. So I, on the days I don't have clinic, I try to come to the lab every day and check in on people, come by and just see how people are doing, how are things going. And, we have also, so we can kind of, troubleshoot on the fly, if you will. I think it's better than just only, restricting yourself to once a week lab meetings, which we always have as well. But coming into the lab and seeing how people are doing, keeping an open doors or maybe open email policy, right? So if they've got questions, I want them to call me. And I don't know if they like it or not, but I set up a WhatsApp, so I can sometimes bing them. I don't know if they appreciate it, but maybe we should ask them. But anyways, so sometimes texting and WhatsApp seems to be a good way of communication too. I think so, but
yeah.
I don't know. Would you like it if your supervisor WhatsApps you?
I don't know. I'm sure it's fine. I like talking to anybody, so I'm pretty easy going that way. Yeah, everybody gets so into their project sometimes, it can be, everybody's different, like you said, right? So definitely having that opportunity is not a bad thing, I think.
Yeah, so open line of communications, right?
Yeah, exactly. Yeah. So as you just mentioned previously, grad school can be quite daunting, and it can be a little cumbersome and time consuming. And so what are some things that kept you motivated when you did your PhD?
So I think, like yourself, Aidan, when you first start out doing your PhD, it's a heck of a lot different than undergrad, isn't it? Right? So so there is no set, follow the protocol, and at the end of the at the end of the lab, you've got your answer and you write it up. So, I mean, I think reading a lot, like, although I didn't like reading, my supervisor, she's awesome, but she'd always be, you got to do more reading, got to do reading, got to stay up with literature. But that is true, right? You gotta stay up with the literature, see what's new, and you can sometimes get great ideas from that. Second thing is, as we've already discussed, having perseverance and tenacity, right? Mm-hmm. Not giving up, realizing, you know what, you're not going to get the answer. You're not in a month or a week. You got to stick it out, and you got to constantly be ready to adapt and change your research. So with that, when you run into problems, you got to troubleshoot, reading the literature, talking to your people in the lab, but also like people at other labs too, reaching out to them, right? So yeah. I didn't realize before talking to G, before we, so apparently my grad student spends a lot of time down chatting with a lot of other grad students at MBP, which I think is fantastic, right? So getting, expanding your network, right? Having that network in the lab and beyond the lab, with your family and your friends, I think that was huge. Having a life outside of grad studies. Yeah. So maintaining your hobbies and not forgetting about that, because sometimes research can be all encompassing, especially when you're under pressure to get that manuscript or to write up and graduate, right? So
yeah, exactly.
That support network. And the other thing is keeping your mind and your eyes open to new opportunities. You obviously do have a main project, but just speaking to my studies, what happened was about halfway through my studies, actually, one of the techs in the lab, Christian, he was doing this different type of screen. It was essentially a phage display screen at the time, and he taught me how to do it. So we worked on it together, and I ended up using it for my project and came up with found this new protein, and that ended up actually being the focus of the remainder of my PhD, right? And it was something I totally wasn't expecting. But it's just by expanding, by just being open to ideas, I think. So having, eyes open, having alternate strategies, things to do, because unfortunately there's no set pathway forward. You got to expect to kind of.
I think a good point you brought up was the adaptability and on top of reading and doing everything, but being open-minded and willing to always, you might have to change your research question, right?
Correct.
You might have to change the direction you're going, either to change the end goal or maybe to go around to get to that end goal, right? So I think that's a really good point.
So just, I know this is you interviewing me, but just for your project, like, are you still working on exactly the same thing that you set out to do when you started?
I mean, I only started recently, but we're already, reading more and more literature, and we are thinking about potentially changing the research question, only within the last few months.
Right.
So we had our original scope, and we're now thinking about changing gears or just slightly tweaking that research question into asking something slightly different, right? Getting kind of a similar result, but it might be due to something different that's going on, right? So
exactly. And to expand this beyond research, I'd say if you look at where the way the world's moving, right? How they're saying, what are you going to do when you grow up? Well, the job, the kids today, the job that will exist when they're out probably doesn't exist currently today, right? So you have to be adaptable. So it's no different in research at the pace where things are going. So
definitely, yeah. So do you have any advice for someone who's interested in becoming a clinician scientist as opposed to just a scientist, or as opposed to just being a clinician? What are some of the benefits you've seen from your job as a clinician scientist?
Okay, so as the benefits, I have to say, I really do enjoy it. Like, I honestly love it. The reason is, I think it's the perfect blend of two passions, which is first, I still love the biology, the research. I think it's really cool. There's always something new. You never know the full one answer, is going to lead you to a new question, right? So I think that the research that you're able to do is fascinating. And clinically, like being able to see patients, it's an honor, that you're basically helping them on their journey. You're coordinating the care. I mean, getting that direct patient care is really fulfilling. And when you have both experiences, you can see the problems in the clinic, questions that need to be addressed, and that you and your colleagues are talking about. You're seeing in front of you with a certain patient that you, as a clinician scientist, could then take that back and in collaborative research with scientists, with other clinician scientists, with clinicians, leverage those resources and bring it back to the lab and back to the clinic. I mean, it's really cool. It's like a two-way street. Yeah. So that's the reason I really enjoy, the profession. But in terms of kind of suggestions, as we talked about at the beginning, Aidan, and we're doing the calculations of like 20 years or something like that.
Yeah.
It is a long haul. Okay. It is not a short haul. So, and I think this is the third or fourth time we brought this up for the interview, but, tenacity, perseverance, and being able to overcome roadblocks, getting kicked down a lot and picking yourself up and just saying you're willing to work through it, right? Because it is a long process, and the process you do as a PhD student, which I mean, I had a great experience. I loved it, but it is very challenging in its own respects. Is totally different than the challenges of a medical student and a resident, right? Being on call or having to study obscene amounts of information, blah, 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 all that kind of stuff. I mean, they're two totally different things, right? And it's a long go, but it's totally worth it. Yeah. Like it is a great thing to do if you can do it, and it's just sticking with it. And if you love it and you want to do it, you'll do it.
So how do you balance your time? Like, how much time do you allocate for each role, I guess I should say, as a clinician and as a scientist?
Right. So like a lot of clinicians, scientists, I would say in Toronto, it's pretty standard. There's it's split, typically 70-30, 80-20 in Toronto. So for example, it's technically 80-20, so 80% research, 20% clinic. So what that basically means is if we start with the clinic, you're looking at, 1.5 days a week of seeing your new patients, seeing follow-up patients, seeing your patients on treatment, attending various clinical meetings like what we call tumor boards to discuss challenging cases, and, calling patients, they have questions, and talking to other doctors about patients. So that can take up, through the week, what is equivalent of a day and a half, sometimes 2 days of work. Nice. And the remainder of the time is research. So that's, lab meetings, going to lab every day, talking to your students, being on committee meetings, writing papers, writing grants. Yeah. All the fun science stuff. So that's pretty much, so probably similar to your supervisor, Dr. Redick. I'm sure he's a surgeon, very busy guy, does great research, has, sure he has the same perspective, but it's good. There's always something different to deal.
Nice. That's really good to hear. So what are some things, I guess we'll go kind of off the scope of research and career-wise, but what are some things you like to do in your spare time? Do you have any specific hobbies? Or
if I could facepalm or groan, I would, but I'm just joking. So I actually spend, honestly, most of the time just with family and friends. I used to spend more time. I have 2 girls, and they're largely grown up, but still, spending time at home with family to me has always been really important. kind of like a homebody. And then the rest of the time spending time with friends, colleagues, going for dinners, stuff like that. That's where I spend, honestly, most of my time. It's going to sound really geeky.
Hey, that's okay.
But I've always loved aquariums. So I've always, when I was a grad student living downtown in our tiny apartment, I had like 3 fish tanks. I still have several fish tanks, so I like doing that. Yeah.
Good thing Ripley's is right down by the CN Tower.
That's right. Yeah, that's a pretty cool place. Been there a few times. So yeah, I've always liked that, and now partly because my daughter, she's gone into reptiles, so she's got a snake. I never thought I'd be a snake person, but yeah, it's actually pretty cool. And we're now embarking on growing something called isopods.
Interesting. I've never heard of that.
Exactly. But if you look it up, you'll see. So, so anyways, yeah. So spending a lot of time with friends and family, and really that's most of it. When you get some downtime.
Nice. So if you weren't a clinician scientist, what was like your plan B, or what could you see yourself doing?
I still would have been a scientist.
Yeah.
So like, I don't know, research is fun. Like, it's just neat. It's cool. I mean, being a scientist, we think, is a very privileged job too. Where essentially somebody's entrusting you with funds to basically investigate a problem you think is really interesting and important. Mm-hmm. And you kind of get to decide how you're going to do that. I think that's such a unique job. So, for my grad studies, my last year, I had applied to do postdocs. So I was going to interview at a couple of places. And so, if I don't know, if I didn't get into med school, I probably just would have done a postdoc. Mm-hmm. And I think I would have been very happy with that too.
Yeah. I'm just going to go back and ask a question based off that I forgot to ask, I think, or I kind of phrased it differently before. But so for prospective students, when helping them, do a rotation in your lab, how do you design a rotation project? Since it's such a short amount of time, how do you help them come up with something that they can really benefit learning from your lab?
I think it is nice if they can have, even though it's only 5 weeks, to have some project where they can still work on to kind of call their own. Now, I understand this may not be applicable in all different types of research that our department does, but usually we like to have them working on a particular protein or target that we've identified. So I think it's just, when you have your own project, it kind of, even if it's just for a few weeks, it's just something you feel like you can read around and have, you can, I don't know, feel more directly involved and motivated around, if you will.
Yeah.
Okay. So in the past few for students, what they were working on, that's became one of the projects when they did the grad studies. The other thing is, if one of our students has like an assay that they're trying to optimize, that's where we might get a student, a rotation student to kind of help with, right? Nice. So then they're paired with that student too. But yeah, that's kind of how it goes. I don't think there's any right or wrong way of doing it. That's just kind of how it's kind of worked for our rotation students.
Just want to say it's been a pleasure, Dr. Liu, and thank you for coming on to the podcast series.
Thank you for taking the time to have me here through my many ramblings, and hopefully it'll be of some use to prospective students who are interested in MBP. It is a great department. Not that I'm biased at all, I tell everybody, but it is a fantastic department if you're thinking of coming to this department, because so many different specialties and interests that you're going to find a supervisor in a project. I'm sure that'll fit.
A lot of different topics too, which I like. Yeah.
Exactly.
For myself, that's what I like about it. Yeah, like that. But anyways, yeah, so everybody watching will stay tuned for the next episode.